Well, the autism program largely grew out of this work and of doing parenting programs in general. And when we train group leaders to deliver this program, they will receive a therapist manual. The parents will get a book on autism that matches up with the program that they're seeing. We get laminated cards that we use to give demonstrations of how to use visuals with these children. And we have our turtle puppet, who's ever present in our program, who helps a lot. Hi, how are you? I'm Tiny Turtle. I'm going to show you how you can calm down by going in your shell. So we use puppets a lot with these children because this is where children are at this age, because we're working in the young age range, where they're really in and out of fantasy and reality. And we have videos that we show, and I'll show some of these to you today. These videos they're on DVD or USB and are streamed as well. So some of the signals of children with ASD, I'm presuming many of you probably know this, or perhaps you have children on the spectrum, or perhaps you're working with children on the spectrum from this audience. And so I call them signals. The S is for that the children's social interactions and their verbal communication is impaired with parents and adults and peer groups. The I is for their imagination, their pretend play, their ideas and creativity can be reduced, and they have unconventional play. Many of you will be aware of that. They might be playing with the same thing over and over again and reluctant to change it up in any way. Their gestures, the G is for gestures, and their nonverbal communication may be limited. They have a narrow range of interests, routines, and repetitive behaviors. The A is for affect. It can seem withdrawn. They may seem to be unaware of others' feelings. They may lack, for example, a smile or eye contact. They may seem very anxious and have difficulty with self-regulation. L is for lack of spontaneous gesture that expresses emotion. And the final one, S, as the final one in signals, is that their sensory responses are unusual. So they may not like to taste certain kinds of things in their mouth or certain spices, or they maybe have irritable skin, or sounds may bother them in certain ways. Now, I've talked here about a lot of kind of things that are somewhat delayed in these children, but I also want to be sure to say that these children are unique and special in many other ways. They may have a real interest, for example, in airplanes or at particular animals, and know lots of things about those. So they are special, they are unique, and I think a lot of times when parents get together in a group to talk about their children and how they are so unique, they really fall in love with their kids again because of that. And that's part of what we want to do. They may be worrying about the things that they lack and they have to work hard at improving, but also recognizing their strengths at the same time. And telling you about the signals is important because that helps us know what it is we need to help parents and teachers learn to do. How to help promote for example, their pretend play or their imaginary world. How to promote their social skills with peers or with others. How to help them learn to understand gestures, to understand nonverbal pictures or gestures to be able to communicate with other people. So the goals of the program are to increase parents' confidence, to reduce their stress, and to promote their development of support systems. And by that I mean parents getting together with other parents who have children who may be on the spectrum or with some language delays. It's so valuable for them to be able to talk to others about their experiences. It kind of normalizes it for them to feel like they're not alone and they can share ideas with each other. Our goal is also to promote the parent-child interactions and the attachment between the parents and the children, and understanding of the children's developmental needs. We're trying to support parents to strategically interact with children on the spectrum in ways that promote their language skills, their school readiness skills, their emotional self-regulation, their social skills, their empathy, and their positive relationships, so that they can do well when they get in school. Now, I don't know that I've said this, but the program is for children between the ages of 2 and 5 years. So the earlier we get to the children, the better. And I'm happy to say that having seen this now, that we are identifying these children as young as 1 year of age now, so we can really get to them and help sculpt their brain in optimal ways. So as I said earlier about brain development, we know that during this time, some of the neurophysiological brain connections are being strengthened. They're strengthened by repetition, by really repeating things more often, and that can help them. And some of the connections are pruned away if they aren't used. So we want to make sure that the right things are pruned away and the right connections are really strengthened and reinforced. And we do know now from a lot of research saying that early intervention has a greater chance of capitalizing on the brain neuroplasticity in early life. A lot of change can happen during this period of time. You'll see this picture here of this little boy, and I know you can't see the little neurons, but the little neurons on this poster, the blue ones are things you can do for emotional development, the yellow ones for social, the green ones for language, pinkish ones for physical, and so on. And this is something that we work on with parents and with teachers. The program itself is offered as a 14-week program for 2 hours once a week in a group. The vignettes, the video vignettes that we show also can be combined to the basic parenting program. There's a program called the basic program. So I'm just going back to that slide again, because I said that we would only look at the autism program at this time. But at the very bottom of that slide are all the programs that we've developed for parents. So you'll see that there's a baby one, a toddler one, a preschool, school age, and then an advanced program. And those are the ones that I started researching in the 80s and the 90s. They've got lots of studies for them. And the idea is that they're developmentally each program addresses the particular developmental needs of children at those ages. Clearly, we're not trying to teach toddlers how to problem solve because they're not ready for that yet. So those are the ones we have a lot of research on, and there's one, they're called the basic programs, toddler, preschool, and school age. And so the autism program really emerged from the basic preschool program, with a little bit of the toddler as well. In terms of developing that. So there are group leaders who've been offering the basic program for years, and many of them have seen a parent come into their group that has a child on the spectrum. And so, which is great, and that's actually true for me, because back in the day when I started out, many of the kids that we saw who came in with conduct problems, behavior problems, probably about 15% of them also at that time were on the spectrum, but maybe didn't get that diagnosis at that time. And so what we know is that we could take some of the vignettes from the autism program and use it in the basic program as well. It helps all the parents. While the program is set out as a separate one just for parents of kids on the spectrum, but if it happened to be that a group leader had such a parent in their basic program, they could use the vignettes, and we show group leaders how to do that. Sometimes there might not be enough parents with children on the spectrum to have a group just for them, so we can have them join in with the parents of neurotypical children. Okay, so what's included in these 14 sessions? This is a list. There are 8 different parts to the program, starting with how to teach the parents to be child-directed in their play, to promote their positive relationships and their attachment, then how to build their language development with the kind of pre-academic and persistence coaching that we do, how to promote their social skills, their emotional literacy as well. You'll see the topics here that we cover. How to help these children learn to self-regulate. Many of them, as you imagine, are anxious because of some of the reactions that they've had from other peers and other adults, and so we want to help them manage that. How do we praise them? How do we motivate them is another topic, as well as the limit setting and the managing the misbehavior. So we use this parenting pyramid as kind of the roadmap for where we're going in the program. You can see that at the bottom of it, and actually 2/3 of the intervention itself, is building a strong and a stable foundation. The foundation part of a positive parent-child interaction or teacher-child interaction is so key to the learning. And usually by the time we get up here on the top of the pyramid, where we're into limit setting and handling misbehavior, many of those have already improved. Getting the strong foundation first is key. And I'll be talking about that in a few minutes in terms of what I call spotlighting, getting in the child's attention spotlight. Okay, so how is this program different from our basic one? That is, we have new vignettes, and so we have some parents with children on the spectrum with some language delays on there. We are coaching with these children is focused on a lot of imitation, repetition, sensory routines that motivate the children, use of pretend play, and promoting self-regulation. We have in this program an increased use of visuals to support schedules or language, ways to speak if the child doesn't have any language at all, the ways to be able to show. So I have kind of one example here of an activity choice board where with the child maybe doesn't have words, but he can point and say, does he want Play-Doh or does he want a puzzle? And he can pick, oh, you want the puzzle, and we can give him the puzzle. And then he has a way to tell us, finished, I'm all finished now, to put it away. So we use visuals so they have ways to communicate. And we gradually increase the number of visuals too. We teach them what each of these pictures means so that they have more ways to communicate with us. We always, of course, pair the picture with the word itself, and we put the word on there. So we have more visual supports. We have feeling cards as well, other nonverbal gestures. We have an increased focus on the ABCs of behavior change, and that is really looking at the antecedent, we're looking at the motivator that will bring about deciding which behavior that we're working on, and then the consequences for exhibiting that behavior. So we work with that. It's more explicit. There's more prompting and spotlighting. And then individual tailoring in the group. So you said in almost everything you read about autism these days, if you've seen one child on the spectrum, you've seen one child. They are all just so different from each other. Some of them have a lot of language, but don't interact and don't communicate at school. Some of them have little to no language. They're all so different. And in these groups, our group sizes are a little bit smaller than in our other parent group sizes. So I think about 8 to 10 parents in a group is good because you're individualizing for each of those families depending on their child. Okay, so we use videos in our group's discussions. I'm going to show you a video now. I'll tell you a little bit why we use it. Early on in my studies, I looked at the benefits of videotape modeling for changing behavior. And I compared group discussion without video and with video and video only in control. And we found that the parents who got the trained group leader video modeling discussion groups had the best effect sizes, the most powerful outcomes in terms of behavior change. So I'm a strong believer that people often learn more by observing interactions, observe a video of a child, say, having a tantrum and how to handle it, talking about how to handle it, problem solving, and then practicing it. So we get it really into experiential learning with these families using the videos. So they're used, really the videos are used as kind of a trigger for discussion with the parents, and then the teacher program is the same thing with the teachers. In this particular parent program, I have 3 families I focus on, which happen to be in a group of mine and volunteered afterwards to be taped. Each of the children are almost 4 years old. The boy and the girl are actually the same age, although one has a lot of language and one doesn't. And I'll be showing you some examples. And I have to say, thank you to these parents who've made such a difference to many other parents now around the world who've really learned a lot from watching the way they interact in such a responsive and loving way with their children. And their children are doing very well, I'm happy to say, because I follow them up because they're from this area. Okay, so we're going to look at this next vignette. I'll try to do this a little bit like I might do it with a parent group, just for you to get the idea of how we use the videos to trigger discussion. In this first one, we're going to see a little boy, almost 4, and I would just ask you to look at it and think about what this father is doing to get into his son's attention spotlight. How does he engage and get into his world with him? In other words, he's not demanding the child to be in the parent world. He's getting in his world with him. In the next vignette, watch the way this father follows his child's lead and attention, and think about what this boy is learning from his father's verbal narration.
You say, "I'm excited." Say, "I'm excited." Well, you're really interested in these coasters, huh? The hexagon.
Okay, so I'm pausing it there, as I would with a parent or teacher group, and just saying, what do we see about what this dad does here? Already he's naming Hudson's emotions, that he's excited. And you can see just from his body language, he's leaning over, he's getting close, he's naming what he's doing with these hexagons. Does he seem interested in him? Really does, doesn't he? So he's kind of trying to get in the spotlight by showing he's interested in what his son is doing. And let's see what he does next.
You got 2 hexagons. 2 hexagons, now they're stacked up. And they're moving together. It's like they're hexagon friends. Whoa, the hexagon is rolling. It's rolling like a ball. And fall down. Crash.
So already you can see what he's doing. He's naming his actions. He's not asking any questions. He's naming what he's doing, talking about how they're rolling as he rolls. He's saying there's 2, so he's giving them numbers. Very effective way of enhancing language. The language is paired with the actual actions of the little boy. And how do you think the boy feels? Somebody narrating what he's doing. It's a little bit like when we watch sports. There's a narrator describing what's happening on the field. And for the little boy, he knows his dad's with him and interested in what he's doing. He's using interesting words like crash. How fun is that, right? And you can also see from his body language, he leans over, leans close, tries to get close to him. Okay, let's see what he does next.
Whoa, the hexagons fell off the table. Down onto the floor. Whoa, one of them came back up again, huh? Is he balancing? Looks like he's balancing. The hexagon is balancing. And it fell down.
Okay, some more narrating, and you notice there at the end how he moved in, the little boy moved in close to his dad and gave him an eye moment, looked him in the eye for just a second or two, and then looked away, and the dad continues to watch him. I suspect the little boy liked the sound of just even hearing them drop on the floor, because he seemed to like that idea of them coming back up and going down again. Okay, that's an example of a video that we would look at with parents, and we would talk about how the father's enhancing his relationship with his son, getting in the spotlight with him, and at the same time actually enhancing his language development. So I talk about child-directed spotlighting, and by that I mean the parent is focusing on the child's likes, what he likes to do. He's giving him choices, and he's allowing the child to be more social and interactive with him. The child will learn that they can affect other people around them, and they don't have to redirect their attention away to somebody else. They don't have to do what the parent wants to do. They're learning that other people are interested in what they're doing. Gradually, the parent can build a stronger relationship connection and eventually extend the child's spotlight to have the child be a little bit aware of others around him. But to begin, we start with the parent getting in the child's spotlight. So I'm going to show you another vignette. This is also from part 1. It's called Child-Directed Narrated Play. And in this vignette, we're going to look at how the same father is encouraging the verbal and nonverbal communication in his son. So look at what he's doing. Look at his gestures. Look at his nonverbals as well as his verbal. Think about what the little boy is learning from this interaction.
So did you want to have any juice or milk in my lap? What do you think? There's some warm milk?
At times, children on the autism spectrum may seem unaware that communication is even occurring between two people. They are less likely to use nonverbal communication signals such as eye contact, facial expressions, or gestures to communicate their needs. You could see even in that video that we just saw there, he asked him a question and he turned away as if he didn't even hear it. He did hear it, but maybe he didn't know how to respond to it. And the dad moves in a little bit closer. As you have just seen, parents can prompt and praise their children for using these nonverbal signals and eye contact during social interactions.
It's great looking at me, Amelia.
That's a very happy, smiling face. Yay!
Parents also can exaggerate their interactions with them with smiles, excitement, and gestures to model these responses and make them socially more interesting.
Are you doing it too? How's it doing the happy?
In the next vignette, watch a father teach his son some of the basics of verbal and nonverbal communication. See if you can pull out the key learning opportunities for this boy.
Aha! There's the bubble thingy.
There's the bubble twin.
There it is.
There's the bubble twin.
You see the echolalia. The little boy repeats exactly what the dad says. This is all developing language. And you can see the tone. Watch the tone of voice of the father as well. Now he's doing something here. You notice where he's putting the bubbles, which is this little boy actually really loves bubbles, so it's a motivator for him. So what's he going to do? Let's just say this is my bubble, and I hold it up here. You're going to look up here, aren't you? So he does things to enhance the language development to get him to look at his face. Okay, let's watch what he does next with the bubbles.
There it is. Okay, what do you want me to do with it?
Blow it.
Blow a bubble? Okay.
Blow a bubble.
All right.
And blow a bubble.
Blow a bubble. Bubble! Boing, boing. Oh, we have two bubbles.
Boing,
You notice there the repetition. He's saying the word bubble many times. He's saying fun things like boing, boing as well. What do you notice about the pacing? It's not too fast, is it? It's kind of waiting for a response before he says the next thing, giving him a chance to repeat back before he goes on. Now watch what he does again. And here's where we get into the importance of the repetition. Notice what he does, what he asks for. He doesn't just straight away go into blowing a lot of bubbles, which we might do with a neurotypical child. He's going to set up another learning opportunity. Let's watch that.
You want to ask for something?
I want to blow the bubble.
You want to blow the bubble? Okay. Ah, little bubble.
A very big bubble.
Okay, you want me to blow a very big bubble?
A very big bubble.
Okay, I'll try. This is kind of a small... A little bigger. Is that big enough?
Is that big enough?
Do you want it even bigger than that?
I want even bigger than that.
Even bigger bubble?
Okay, so we're seeing there how he's giving him choices so that he can indicate what it is he wants, so he can communicate with them. And the little boy is learning that he can use his language to ask for what he wants. So he's learning how to ask for it and how to designate the size of the bubbles. So he's also learning language for size, small and big, multiple. And again, does he stop there and just blow a lot of bubbles? No. Watch what he does again. He gets another learning opportunity. So always engaging in interaction and communication with him. Really in the spotlight, in his spotlight.
What should I do again?
Blow.
Blow a big, okay.
Blow a big bubble.
You gonna pop it,
No pop.
Hudson? No, you're just gonna watch it? Okay.
And this then you watch it. Blow the bubble.
Okay.
Bubbles, bubbles.
Okay.
Bubble, bubbles, please.
Okay.
Really learned how to ask now, hasn't he? He keeps going. He knows what to say. Blow the bubble, please. He's expanding the language as well.
Okay. Ah. Here, I'm gonna blow a bunch of bubbles. It'll be easier. Whee! Now this time, do you want one bubble or a bunch of bubbles?
A bunch of bubbles.
All right. Can you look at me with your eyes?
I want a bunch of bubbles.
Okay. All right. Whee!
So there we see he's totally engaged him and interacting with him. He's got language going. What do you think about that relationship? He looks happy. He's excited. They're really together, and there's a lot of learning going on here with that. Okay, that's just another example of how we try to show how you can really enhance the children, how the relationship and the language. Now, many of these things I discussed on this slide as we went through the video, so I'll just do this pretty quickly. You saw the face-to-face contact he was getting, how he got his attention before talking. You saw how his sentences were simple and they were short, narrated what he was doing. No questions, no commands. He was using one of his favorite activities to engage him, to get in the spotlight. He waited, he paused for the child to respond before doing it. He didn't just entertain him with the bubbles. He waited each time. Listened, imitated, and mirrored. He would do it, the child would say it, he would repeat it back again. That's all enhancing. He used his sounds very well with him. Now we have something, if we have a child who just speaks one word, then we know we're going to try to expand him to add a second word. We call it the one-up rule. So if I had this ball here and I knew that you knew the word ball, then I might say red ball. I would add one more word. I'm not going to add 20 more words, too confusing and too complex. I'm going to do the one-up. If I have a child who can't say the word ball yet, but I'm working on but, then I'm going to go ball, and if I do that enough times, I'm going to do and he's going to fill in the word. So, we're kind of chunking it down, if you were, depending on where each child is at in terms of their language development. So we want to keep it simple, lots of repetition, and we want to slow down. Combining the words where we can. So if I was trying to teach him, for example, what this meant, I would be combining the actual object with the visual picture first while I tried to teach him. Ball, so he would know how these are connected. And at another time, when there's no ball around, he has a way of indicating to you what he wants from the picture. So we want to use this narration not just during these play times, but also other times, such as mealtime. We could talk about, banana. We could name the objects. And we can do this during teeth brushing, during bedtime, during dressing, in this same kind of way of pacing, imitation, repetition. We also we use a lot of puppets as well to enhance that. So your puppet can come in, and your puppet can say things like, say, the puppet, I'm there, and my child is in front of me, and my puppet can do what I would say. My puppet can say, ball, please. So my puppet can model the skill that I'm trying to teach. I could do it personally, I could say it, but using the puppet can also be a way to really get in this child's spotlight, to be interesting in that way. So we have these visuals. I showed you one example of them. We make them up, in general, try to make them up with pictures of the children themselves. So we have pictures of their favorite toys. These ones were taken, many of these from the website, which are available to anyone. But I like to use the pictures, take pictures of them. If we were doing, for example, feelings and they're happy on a swing, I'd have a picture of them on a swing and have the word happy on it. Or when I'm making their pictures of their favorite activities, I would try to have pictures on here of them, whatever that is, playing soccer or playing with Play-Doh or whatever that is. So it's real for them rather than the more generic pictures. It doesn't mean you can't use those generic pictures. I personally just like to use the ones that relate to the things in their family and their homes. So the next thing that we look at is called pre-academic coaching. This is really focused, the first part is a lot on relationship building with the child. This part 2 is language development and school readiness skills. With that, if we would need to know that the children had some language, we would be describing the objects, we would describe the shapes, the actions. We saw the tape earlier, he was describing actions, rolling, for example, and he described the shapes, hexagon. Children with more language than that, you can begin to expand to describe the color or the name of the dinosaur or the positions, on top of the head or under the arm or behind, so that they get to know what those positions mean. Again, we try to avoid questions because often we ask the children the questions, but they don't have the language to respond, and they get frustrated and they kind of withdraw from the situation. Modeling is so key in the children learning, so modeling new and complex words. You might have thought that hexagon was too advanced a word, but not really. He was describing the hexagon while he was actually holding a hexagon, so he was learning what a hexagon is. So even if they don't understand it at first, they will. We recommend combining these interactions with songs and rhymes. So in the first one we saw with the hexagon, there's another vignette where it shows the same father taking the hexagon and going, the song of the wheels on the bus go round and round, round and round, and he's doing it with the hexagons on the bus go round and round. So we try to bring simple singing songs in, and for these children, they love those, and often it is a way of getting in their spotlight with them, or using the gestures, rolling. You might, if you had a ball, he's rolling. You might copy, if the parent has a ball as well, copy what the child's doing as they're saying rolling. Children love it when parents copy what they do and combining it with the words they learn. So using songs, parents describing their own actions to their children, what they're doing. I'm putting on my shoes can be a powerful way for children to learn. I mentioned matching the real objects with the words and the pictures, and praising the child for listening, for eye contact. Okay, the second type of coaching we talk about is called persistence coaching. And this is pretty powerful. Persistence is when you're describing what the child is doing. For example, I might say, you're working really hard. You're concentrating. Oh, you're so patient with that puzzle. I think you're going to get it. You've almost got it. Oh, wow, you're looking at how all those things fit together. So it's keeping them going. They might give up, they might get frustrated, but it's keeping them going. So there's lots of words you can use. The number of words you use will depend on the child's language level. So it might just be you're being patient, and that's the same one you do over and over again. Or if a child with more language, you might build it in more things, like you're trying again, you're thinking of a new way. If you know that he has that many words that he can understand that. You're staying focused on that. For children with no language at all, it might be just thumbs up, good job, and a big smile. Wow, that's so great. So it's that, giving that approval that they're getting it, they're doing it, they're sticking with it, and you're pleased with that. Well, we encourage the children to explore to experiment and give them support in that. We are trying to develop their independence. As you saw in the earlier vignette, he did give the little boy choices, encourage him to have his own ideas about what he wants to do. Big ones or little ones, or many or few, or one only bubble. We try not to give too much help here. Maybe you have to give a little bit to support it for them to be successful, but basically we work on them trying to stick with it as much as they can with the verbal and the nonverbal responses. So how is the language different for children who have little or no verbal language? I've talked a little bit about that, but I'll just try to summarize that. You know this with your babies. Their first words are the names of objects or things that the child uses daily. Maybe it's shoes, a food item, or a clothing item. And actions, as we talked about before, listening or waiting or hand washing or toilet, using toilet, brushing, those kinds of actions. And then you'd move into positions, up and down, behind, and use gestures with simple words. That's what you start with. We're not going to start with colors and shapes and numbers and all of that. It's too complex until the child has more of these basic languages. Slowing down the pace with a lot of repetition, a lot of imitation. Pairing the language with the visuals, avoiding questions, waiting. One of the hardest things to do. You always want to fill it in. Waiting and pausing to see if the child will respond. Even if I said to you, do you want the ball or the Lego? I wait to see. If he points, say he pointed at the ball, right, ball, you can have ball. He gets it. He doesn't have to say ball. He pointed, so he understood the instructions and he told me what he wanted. Being enthusiastic and acting as if you understand your child is so important. Even if you don't understand, act as if you do understand. Because if they can see in your face you're really confused, they might think they're doing something wrong. And then I commented on the one-up rule, adding one more word to their usual sentence structure. I'm going to show you a vignette now of a parent reflecting on their efforts to use child-directed play.
Can I play with you?
Yeah. But I'm gonna have a one. But I'm gonna have a down, and you're gonna do like that.
With my hand.
Next, we see two of the parents talking about what they learned about child-directed play after participating in the Incredible Years parent group.
I'm gonna for a spin.
Over a spin. Being child-directed was something I did frequently, but I didn't necessarily take advantage of it as a teaching situation because I wasn't thinking of it that way. If I'm always trying to draw him back to something in particular, I can try for a little while, but frequently it'll just get frustrating. Should we spin you to the right or to the left?
To the right.
To the right, this way? So if I want him to keep learning but having a good time, it's easier sometimes to go along with whatever he's doing.
I was very concerned at first, how am I going to be child-led when I know I have to direct her in doing A, B, C, and D because she can't? How am I going to put those two things together? I'm thinking it's red and yellow. I'm thinking I'm going to put it in green. Oh, you switched it to go in red because it matches with the red?
Yeah.
Oh, that's so smart. And then over time, I started to realize that I could use lots of different coaching strategies in order for her to become interested in certain things and then use her child-directed things or her favorite preferred things as rewards for that ability to kind of expand her skills. You got them all down, all of them.
You're just helping me go around the table, that's all right. You're just being friendly? You're just being friendly, Push?
Yeah.
One thing he likes is if he's running around the table, he likes to direct me. Like, he likes to tell grown-ups what to do. If we're playing, like knocking a balloon around or something, I'll generally do what he's doing. I'll join him in on whatever activity he's doing.
One of the things she never really was interested in was balls, throwing and catching, you know, the visual spatial skills that makes it hard for her. And being child-directed one day, you know, she wanted to throw a toy. And I said, you know, the car stays on the ground, but we can throw balls. And so I brought the ball bin out and she started throwing them and that was it. Thanks for doing the softer ball so we didn't hit any and break anything. I just found a way to incorporate the throwing into a fun thing and now she throws all the time and wants to play catch. So that's just one way where I kind of went with what she was doing but tried to incorporate what she needed to work on.
Okay, so we're going to move on from that topic to the next topic, which is social coaching. And of course, these are things that you all want children on the spectrum to learn how to socially interact with other peers and with other people. And so I'm just showing you the pyramid again. It's just showing you how we move up the pyramid. We've done child-directed play and narrated coaching and persistence coaching, and now we're into social coaching. So I'm going to show you another video here. And this is the same father who is helping his son learn the social skill of taking turns and to understand what taking turns means. So just see what strategies the dad's using here.
One of the milestones for young children's social development is to learn to interact with others by taking turns.
Por favor, dile. ¿Me lo prestas? Gracias, dile.
The ability to cooperate and give and take exchanges is fundamental to social development, but difficult for children on the autism spectrum because they are so focused on their own activity and oblivious to others. For children with language delays, they may not have the words to ask for a turn or even understand another's request for a turn.
Okay, it's Nika's turn to pick.
As we have seen, parents can help their children learn to shift their attention from objects to other people
She's gonna pick when it's her turn.
by spotlighting others and their needs. In the next vignette, watch how the father uses gestures and words in the balloon game activity to teach his son how to take turns and share.
My turn. Now it's gonna be your turn, okay? Hudson's turn. All right. Will you give me a turn now?
So already you're seeing how he's saying, my turn, he's holding it, and then he gives it to him, your turn, he's entering, and then he's asking for it back again, so he's using the gestures and repeating the words, my turn, my turn, so that he gets to understand what that means. So he's teaching that social skill of what that means. Let's see what he does next.
Give the balloon to Papa. Oh, you hit it to me? Okay. Hit it to me. My turn. Okay, I'm gonna hit the balloon. All right. That's my turn. Here, now it's your turn to hit it. Hudson's turn. Woo! Woo! Okay. Can I have another turn? Hudson, will you give me the balloon?
So you see lots of learning opportunities. He sets it up, he has it, then he has it back again, repeating that for him to learn the concept.
Here, will you bring me the balloon? Bring me the balloon so I can have a turn. Thank you. Thanks for the turn, Hudson. That's very friendly. But now we can play with the balloon together. We're sharing. We're sharing. There we go.
He now understands what sharing is. He praises him for that, for giving him the balloon back. So he's praising and motivating him for that as well. So now he's just really concentrating in a nice paced way with helping him understand my turn, your turn, what sharing means in an experiential way as he's actually doing it. Now, we do know that he loves balloons, so he's used an activity that he knows will engage him, that will get him into his son's spotlight. So in this next slide, I'm going to just tell you the ABCs here. So the A stands for antecedent. That is, what is the motivator that will motivate the child to be engaged with the parent or the teacher? And in this case, he's using the balloon. It's the object there is to get his attention, and it certainly gets his attention. He wants to play with that balloon. The behavior that he's trying to get him to learn to do is wanting him to know how to share the balloon, to go back and forth. So he's identified what behavior he's trying to prompt, he's trying to teach him. And the consequence, the C, is that he gets the reward. So he shares it, but he gives him the balloon back pretty quickly. So he gets to be rewarded, doesn't take it away from him forever. And then he praises him, and he mirrors the words and the gestures. So it's this principle of he keeps it simple, slows it down, so he understands. But he's using the antecedent, he's using the motivator to get him engaged. So those are the ABCs of helping children learn something. We talked about spotlighting social coaching now, and that's turning up the spotlight on your child's social skills. So that would be modeling. So I might say to my child, let's take my Legos, if I was playing with my child and you were my child, I would say, I'm going to be your friend and share my yellow one with you. Now that would be for a child who has quite a bit of language, but you might reduce the number of words you use with a child who doesn't have Lego and hand it to him. I'm sharing Lego. 2 words maybe, sharing Lego. So the modeling of the skill yourself is really important. I can model to share. I can model to ask, can I have your green Lego? To see if he learns about that. I can model pointing and gesturing, smiling, eye contact, and praising. So modeling on the part of the parent or the teacher is really important. The next is trying to stay in the child's spotlight. You want to make sure that the child is actually watching the social skills or the gestures that you're modeling or that won't work. So I have to keep it interesting. So maybe I know that, he likes sound, so I might do to get his attention, and then maybe share with him my yellow one. Naming the social skills, so I'm sharing, or I'm waiting for my turn balloon. So naming the social skill that you're using and prompting the child to take a turn. So that would be what I just did. Can I have green Lego, please? I'm trying to get him to learn. And then if I do get the green Lego back, I'm going to be enthusiastic. You shared with me. I feel happy. So giving him feedback on the fact that he shared. So this is called kind of turning up the spotlight on the child's social skills. Praising, if your prompt results in a successful social behavior, then praising it. But if it doesn't, if I ask, can I have your green one, and he doesn't give it to me, I let it go. It's not a command. So that's important to understand. It's just a kind of a suggestion. Sometimes he might respond, sometimes he might not. When he does or she does respond, then I'm enthusiastic about it. Participating in pretend play, the same thing I showed before. Or maybe I'll do it with a character. My little character will say, please, green Lego. So instead of me doing it as a parent, my character can do it. Or my little puppet can do it. What am I? I'm a sheep. Bah, bah, bah. Block. Block, please. So I might do that. So that just kind of keeps them engaged and interested in what you're doing. To use the action figures, or to actually prompt them with what to say. So you can do that. You can ask your friend, please truck. Say, please truck. So you can actually give them the words. If you just say, ask for what you want, they might not know what that means. But if I say, please truck, and they'll likely repeat that, and then they get the truck. So they are given the words that they can try. It's like learning any new language, right? If I'm trying to learn a new language, I need to hear it a lot, practice it a lot, and using visual responses. So if I'm doing something like I'm waiting, say I'm the adult and I'm waiting for my turn, I might use a visual, I'm waiting. Once we teach the visuals for the social behavior, then teach the pictures, we can prompt them in other occasions, like, good job waiting, you're waiting for your turn. So we might need a visual prompt to remind them. So these are just example pictures here on the slides of different visual prompts for promoting social behavior. You see we have them for sharing. So when I was doing the sharing earlier, maybe I don't have it right in front of me. Yeah, I do. I'm going to have the sharing, you're sharing with your friend. So I see that he's sharing something with another child, and maybe I'm going to use this along with the praise so they understand what that is. Asking, saying please, are social skills. Sensory physical activities can really enhance social interactions. So I'm going to show you another example of that with the same father. And we'll go through this one a little bit quickly, but I want you to notice how the father keeps engaging the little boy here.
Since social interactions are not as rewarding for children on the autism spectrum, finding ways to increase their pleasure in social exchanges is important. Most children on the spectrum enjoy sensory physical activities, such as dancing to music, running, bouncing on a trampoline, being chased, and swinging. These activities can serve to increase their internal motivation to seek social play interactions and engage longer in social activities. Watch how this next father uses a spinning activity strategically with his son to foster their reciprocal communication.
All right, how's it sitting in the big chair? Okay, you taking a break or do you want to go for a spin?
I'm going for a spin.
Go for a spin.
Go for a spin. Hi, Hudson.
Okay, what do you want me to do?
Go faster than fast.
Spin faster and faster?
Faster and faster.
All right.
So you know he's got his antecedent here, his motivator. He loves to be spun a lot, and he gets him to indicate exactly what he wants him to do. He flips up to make sure he gets eye contact when he asks that because he's inside his egg now, and gives him a choice. Yeah, so again, he's totally with him, isn't he? Okay, now see what he does is he starts the spinning.
Now, should we do it clockwise or, oh wait, should we spin you to the right or to the left?
To the right.
To the right, this way?
To the left.
This is to the left, okay. To the left? To the left, okay. Here we go. Whee! Oh wait, I'm spinning you to the right now, is that okay?
Faster and fast.
Faster and faster? You say, spin me faster and faster.
Faster and faster.
Okay, here we go.
That was an example of a prompt. He says, you can say, spin me faster and faster, so he's giving him the words. So they're in communication the whole time here while this is going on.
Whee! You're going round and round and round. That must be pretty exciting. Is that exciting? Is that exciting?
Okay, he doesn't get an answer. So he stops it, pulls it up, and looks in to get a connection. How tempting would it be sometimes just to entertain your child while doing this round and round and round and not communicate, or keep swinging them on a swing and not communicate? But he uses it, he pauses the action in order to get an interaction with him. And now watch what he does.
Is this exciting or is it boring? What do you think?
Exciting.
Exciting, oh yeah.
Faster.
Okay, faster.
Faster than fast.
Okay, this time should we do fast to the left or fast to the right?
Fast to the right.
Fast to the right, okay.
Has choices, and he's totally engaged. So the idea is not to just be passively involved in entertaining your child. You're using the, in this case, the spinning wheel to engage with the child, with them in their spotlight. And I know it can be really tempting to just think, oh, well, they're having a good time, I don't need to do anything else. But actually, he's taking advantage of the opportunity for learning here. When your child seems withdrawn or uninterested or bored or unresponsive, which is what we just saw, he didn't respond, thinking about ways you can increase his energy and his motivation. And we saw him do that. He exaggerated his response. He's kind of over the top with emotion. Excited, is everything about his tone. Big laughters, big smiles, silly. But there are plenty of other things you can do. If the child likes to be tickled, this little boy happens to like to be tickled, you can use that. Funny noises, drawing attention to your face. Playing games with them, like turn it into a peekaboo, or turn it into, this little piggy went, where did he go? Make it fun, have it disappear, have a hidden object that they have to find, build a fort in your living room or something to keep them engaged. To, again, determine their favorite rhythmic song or physical game. Maybe they like to be swung in a blanket. That can be often very reinforcing. You can use that as a motivator for teaching something. Surprise the child occasionally with a variation of the routine. So maybe you do something really silly, like instead of putting the shoes on his foot, you put them on his hand, and see how they respond to that. Those can really be exciting to them. Using a new sound or a new verse, new steps are fun to do. Using puppets in the sensory routines are fun. Pausing your sensory routines often to prompt the child to signal you what they want next, Wait for that signal, whether it's verbal or nonverbal, and then continue the game again, and then pause again and wait. So it's that repetition that we just saw in the last vignette. And as I said earlier, not simply entertaining your child, you need to require your child to stay connected with you by responding. So here we have a little reflections about the social coaching.
It's my turn. My turn. My turn.
Next, we see several parents talking about what they learned from the Incredible Years parent group about social coaching.
How can you ask like a big girl? Do you remember?
I want to give
May I have a turn, please?
Give it right now.
I really wanted to try to improve her social interactions. She really wants to interact. It's just that sometimes she just didn't do it appropriately.
Give it right now, Mama.
Couldn't pick up on social cues, didn't know body space. So I thought that the social coaching would hopefully help. May I have a turn, please?
May I have a turn?
That was such nice asking.
May I say please?
You did say please. That was so polite. That's really nice of you to ask.
I didn't say please. I just said may I.
You know, I can ask for a turn. I can, trade. She knows what those things are, but coming up with them in that situation, I know for all kids is difficult, but sometimes for a child on the spectrum, they really have to memorize their options.
Truman, let's play Sneaky Squirrel together. Do you want to play Sneaky Squirrel?
Do you want to play Sneaky Squirrel, Truman?
I want to.
He doesn't want to, but I would like to. Can I play with you?
Yeah.
Amelia, that was such nice asking if I wanted to play. When I coach Amelia socially, I do it one-on-one primarily. And then when my son is there, it's a little challenging because Truman is 21 months old and Amelia's 3.5. And so I've really got to manage the issues that a 21-month-old has with not really fully understanding sharing, and the 3.5-year-old is still trying to gain the skills needed to ask for a turn or to trade. However, I've seen that the younger one, is learning a lot of these words already without even fully understanding the concept. It's interesting. She'll say trade, and he knows to hand her something now.
I want to blow some bubbles.
Hudson wants to blow bubbles?
I want to.
You say, I want to blow some bubbles, please?
I want to blow some bubbles.
You want to take a turn? Okay, you can have a turn. In regard to social coaching, there's been some mixed results, like when there's actually other kids around, and I'm trying to get them to take a turn, or wait a minute. Ooh, can I have a raisin, please? Can I have one raisin? Will you share a raisin with me? Just one? Thank you, Hudson. Thank you for being a good friend. But when I've done role plays with him, it's a lot easier. In the situation with other kids, like, he's usually already upset before it comes up. Oh, do you want the balloon?
On the balloon?
Yes?
Yes.
Can you look at me with your eyes? When I've done practice with him, he seemed engaged and interested in it.
Oh, on the balloon, please.
All right. What a nice look. Thank you. He's not as emotionally involved, so it's not such a big deal, so he's willing to practice it.
Emotion coaching is the next one we're going to talk about, and it's delivered in much the same way that we've been talking about already. We'll begin describing. We've seen this dad describe every time Hudson's excited and happy. We don't ask him what he feels. We can see from his behavior, you can see how happy he is, and we name it. And we try to label more positive feelings more than negative feelings. Oftentimes we find children have their negatives more likely paid attention to than their positives. So we want to label, like, you're looking curious. When I talked earlier about patient, those kinds of words, you're looking like you're really proud of that. So build some. Look at what emotion words your child has. If he doesn't have any, then start with one positive and one more uncomfortable. Maybe it's happy and it's sad. And then gradually you'll build them. And I also use a lot of pictures for this too. So I might take the picture of the child giving me their happy face. Another child with a happy face. The same child, I might show their scary face. And making these, that's the thing about nowadays, we can get these pictures so easily and so fast compared to when I started. I would put the word happy, or this one could be frustrated, or this one could be fearful, depending on what we decide that feeling is on there. And there she is happy. So using the children's own faces to teach them, or parents or siblings' faces to teach them what word goes with that face, because they often can't read the facial feedback that they're getting. If we're naming uncomfortable feelings, then one of the things we try to do is pair it with a coping or a persistence comment. So if we're saying something like, the mummy is kind of saying, you look really frustrated with that. I think you're going to get it. You're looking like you're figuring it out, whatever it is. You're staying calm and trying again. So trying to pair the uncomfortable feeling with a coping statement. Again, the amount of language will depend on the child's language level to begin with. It may be really simple at the beginning. So we use the visual pictures for nonverbal children about feeling faces. We use the puppets to share their own feelings. So the puppet can show that he's feeling kind of, I'm kind of nervous and kind of afraid right now, so I'm going to go in my shell and take some deep breaths. And he goes in his shell. I'm thinking of my happy place in here. Do you know where my happy place is? It's like in the ocean or in my pond looking for insects. And that's what I think about when I get a little frustrated with something. So you can use the puppets to help demonstrate the feelings and how they maybe manage that feeling. Connecting the feelings to the social interaction is important. So you look happy because your friend shared his truck with you. So connect the feeling with the action of what happened there. Or your friend's happy because you shared your ball with him. That really helps with emotion coaching. Part 5 is about pretend play, and I've shown you a little bit about that as we've gone along, so I'll go through this one really pretty fast. But puppets are really pretty valuable ways, or the characters. You can use the character. I've got a little girl here, or a character can be made out of your Legos or whatever. This can suddenly become Mr. Policeman, or whatever that is. So the puppets like to show interest in the child, so modeling, what do you like to do? What's your favorite food? What's your favorite play activity? Puppet can ask for help from the child to promote helping behavior. It can share an emotion. It can share something. Would you like a turn? All of those things your puppets can do that we talked about, parents being and teachers being able to do too. Puppets can wait. Say, I'm waiting my turn. That sort of thing. If your child has no language, the puppets can still model the words, keep them simple, and respond to the child's nonverbal responses. Try to use a different voice for the puppet character, and then go out of role and praise your child and praise your child. If you can praise your puppet for sharing and for their social skills, so I can tell my puppet that he did a good job. Waiting or taking a turn. The 6th unit is about promoting children's self-regulation skills, and this is using puppets. And so I have one little vignette on this one. I'll show you that right now. Again, look at this one and think about what self-regulation skills the girl is learning.
Is he in his turtle shell? That's a very good question. I think he might be in his turtle shell. Is he taking a deep breath to calm down?
My turtle shell.
So in this case, the little girl's brother, who's about 18 months old, is crying and kind of upset. And the mother is saying that he's going in his turtle shell, and then the little girl picks up the puppet and tries to think about, how to calm down. And the mother fosters this, and look at what she does.
Taking a deep breath and maybe thinking of my favorite place, like the swing or the trampoline.
She's also offered 2 different ways of self-regulating here. She's offered the idea that he can take deep breaths or think of his favorite place, his happy place, which would be a swing. So she's got at least 2 that she's worked on with her to understand how to self-regulate. Having positive imagery can be a very effective way of trying to calm down.
Oh, it's okay, Trin. I know, sweetheart, I know. Shh. You're in your shell. You're in your turtle shell, just like the little turtle. Taking a deep breath.
I'm going to take a deep breath.
We could try. Let's show Turtle how to do it. Say, Turtle, you smell the flowers and blow out the candles. You want to help Turtle do it? Say, Turtle, this is how we do it. Show him. You're such a big girl. You know how to do it. I know you can show him.
Am I 8?
Oh, I bet you know how if you're 8.
Mom.
Can you help me? I don't really know how. Oh, please be gentle. That hurts me. I need to take a deep breath. I'm a little scared.
Mama, look at it back. Look at it back, Mama.
Maybe I say, Turtle, come on out. It's okay. I'm here. I'll be gentle. I'll be gentle. Oh, you're being real gentle. I'll come back out. I don't know how to take a deep breath. Do you want to show me?
So what's so effective about this little vignette that we saw is how she turned the example into a way of trying to get her daughter to teach the turtle how to calm down, which was really an effective strategy to use. Clearly, she's taught her this before, and she knows what it is. She's seen how she's trying to get the younger 18-month-old to calm down. She's modeled that as a parent, and now she's trying to build on her independence, if you will, to show Turtle how to take those deep breaths himself. That's a lovely example of that. And what's key about this is she's not doing it really at a time where the child is dysregulated. She's teaching the skill of calming down at a time when they're having a fun time together, or at least she's seeing her brother dysregulate. So she's using that as kind of a moment to be able to teach this practice with her. She herself is not dysregulated yet. And so we have visuals of this too, of Tiny Turtle thinking about his happy place. We use the visual cards to build the emotional literacy. We use books in terms of practicing the self-regular skills. We use something called a calm down thermometer. I have a picture of that I'll show you in a minute. And we describe the child's self-regulation, staying patient and waiting, using words or gestures when frustrated, or going in the shell. So I've seen a lot of the kids I teach this, they'll often put their heads under their shirts. And with many of the kids too, we actually make turtle shells that they can go inside when they want to take some deep breaths. So here's some pictures here of the self-regulation skills that we use. You notice she said smell the flower and blow out the candle. We have a picture of that. And there is the calm down thermometer there as well, going through some of the strategies again and using the visual to help them get from hot, bring themselves down with deep breaths into the calm blue place where they can be relaxed. Parents modeling those self-regulation skills themselves for their children is very powerful. So a parent can say, I'm getting a little frustrated. I think I'm going to take some deep breaths right now. So the children can see that you're using it. And the puppets can do the same, modeling the self-regulation skills. The benefits of using puppets for teaching children self-regulation skills are great. It was really what motivated me to start the autism program in the first place, was pulling a child out of one of my small group child programs who was really dysregulated with the other kids in the room. And it was so distressful for the child that I pulled him out and just worked with him individually with a life-size puppet. And he was a different child, completely. So I worked one-on-one, and then I brought another child in and introduced that. Really convinced me at that point in time that we needed to be doing much more puppet work with these children. Now, having said that, for some children at the beginning, they might find the puppets a little scary. They might even punch the puppet. But those are all learning opportunities. Puppet will talk about he didn't like being punched, just like she just did. She talked about the puppet was a little scared, wanted gentle touch. And so the children will quickly learn. And they seem to be much more engaged with the puppets in some ways with the adults at first. So the puppets can enhance the children's understanding of other people's feelings and perspectives. Puppets can model the feeling language, the empathic caring responses, ways to calm down, and are easier sometimes for these children than for interacting with the adults around this subject. So here are some of the calm down visuals that we use with the kids. You can make your own, though, too. Take a picture of your child calming himself down. And here's another parent reflections here as well, talking about how they've used the calm down strategies with their children successfully.
So if you're feeling really mad, you can put the arrow here and you can say, Papa, I'm mad.
Papa, I'm mad.
Next, we see the parents talking about what they learned about teaching their children self-regulation skills.
One of the pieces of advice that seems helpful is practicing calming and practicing these things when he's not upset. Because at this point when he's upset, even when he's not in the red, even when he's maybe a little bit upset, halfway there, he's still not really willing to practice taking deep breaths.
He's going 3 times.
Put the arrow here.
Yeah, and after, when he takes a deep breath, then the arrow comes down here.
I feel like some of the things that have helped with self-regulation are giving him a lot of encouragement that he's okay or he's going to be okay and he can calm down.
Oh, it's okay, Trev.
I've tried to model it because obviously when you have 2 children, 1 and 3, you're going to get a little frustrated at times. And so there have been moments where I'll say, oh, Mom was frustrated. I need to take some deep breaths. And so I'll even model like smelling the flowers, blowing out the candles.
Well, you're in your turtle shell just like the little turtle. Taking a deep breath.
I'm going to take a deep breath.
We could try. Let's show Turtle how to do it. Say, Turtle, you smell the flowers and blow out the candles.
Do you want to have a little bit of warm milk in my lap? You can say, I'm mad.
I have started modeling some emotions. Like I have started taking more deep breaths and I try to remember my yoga classes and how much the focus is on the breath there. And if I'm really tired, then I'll try to just take a break and see if he'll do something on his own. Or even sometimes recently I've just laid down in bed and he's actually come in with me.
I'm running in the red. I need to stop. Take a deep breath. And go in my turtle shell.
We talk about the different things that she could do when she's angry. I think once I actually caught her in her turtle shell. I don't know if she was really, really angry or if she was just starting to get angry, but I caught her in her turtle shell and I right away praised, I see you're in your turtle shell, you're making yourself calm down all by yourself, that's great. So really defining it, describing it, talking about how to regulate it, kind of putting it all together.
I'm going to think of something that I love doing, like going on the swing. And then I think I'll come out and try again. Hi, I'm going to try again. I feel better.
So the last 2 parts I'll just tell you about. One is about praise and rewards, and we've already talked about that quite a bit, but that's part 7 in the program. And we think about how we can praise in effective ways. Again, using many of the strategies that we have used.
Set up a train track.
This father has been clear and respectful with limit setting.
We're all done spinning for now.
I'll spin some more now.
However, just like any other child, at times children on the autism spectrum will yell, tantrum, bite, be defiant, refuse to comply, and be physically aggressive.
No way.
If your child's goal is to get your attention with his behavior and get you to back down on an important limit or learning experience, then giving in to this negative behavior or giving it attention will actually reinforce and strengthen it. As this vignette continues, watch how the father attempts to distract and redirect his son's attention. Think about how long you would continue to do this.
Hudson, how about if we read? We have a lot of new library books. You can have a calm. Hey, Hudson, no hitting, no hitting. We can have a calm body. You can have a calm body. Safe hands, okay? Safe hands. I have a different idea, Hudson. Do you want to have a little bit of warm milk in my lap? You could say, I'm mad. Hudson's mad.
I'm just a pop by file.
You can take a deep breath.
I'm just by file.
You can take a deep breath. You can practice being calm.
By file.
When I'm mad, I take a deep breath and I say,
I'm just by file.
I'm going to be okay.
I'm just by the
You can say,
file.
I'm going to be okay. You can ask for a hug.
I'm just by file.
You want a hug, Hudson? I'll give you a hug. You can say, no, thank you.
No singing.
But limit setting is the next part of the program, and we'll use many of the principles we've used already. We try to avoid unnecessary commands or complex instructions, keeping them simple, being realistic in our expectations, using do commands. Walk quietly rather than don't run, which is very confusing. I'm using polite instructions. Again, pairing them with a visual. So we might have a visual for the command for going to the toilet or washing their hands or brushing their teeth. Giving the children time to respond, waiting for them to respond, not expecting instantaneous. They have to process the words or the picture before they will respond. Giving them choices whenever we can is effective. So with limit setting, praising their compliance is important. Having consistent rules. So we've got the pictures of the key rules. I call them dinosaur rules for the family. Giving them reminders and redirective. So when sometimes we just have to redirect them to something else when you can see they're getting dysregulated. We're trying to strike a balance between parent and child control. And we're trying to ignore behavior that is not harmful to others when we can, or distracting and redirecting them. And of course, we've been teaching self-regulation, so if we can prompt them to self-regulate, once we've taught it repeatedly, they might use it. Not all the time, but sometimes we can get it early enough that we can prompt it before it dysregulates. Thing to remember is that every time a negative behavior is not reinforced with your attention, but instead a positive behavior is rewarded with your attention and coaching, a productive learning opportunity has occurred. So in fact, every interaction with your child is a potential learning opportunity. Getting in your child's attention spotlight with positive discipline helps them feel loved, safe, and secure. So this is this little poster that we use with the program about all the different ways that we can get in your child's spotlight. Many of them we've talked about here as we've gone through the program. Think about how you spotlight your child. There is a program for teachers as well. It's a different program. I don't have time to talk about that today, maybe another time. But it goes through many of the same things, only in the classroom where there's multiple children, which these children may seem, for example, very verbal or more verbal at home, but they get to school and they withdraw completely. So how we can help them. And that program is a 4 to 6 2-hour weekly session offered to the teachers. Parents can join in. We like the parents to have had the parent program first, ideally. And the goals are very similar: to support the families and the teachers to strategically attend to play and help them promote their language, their social skills, their empathy with their peers. And again, to develop a support system for the teachers themselves to enhance their competence with what they're doing, their understanding of the valuable role that they play in promoting these children's optimal social, emotional, and cognitive development. So I have a little reflections at the end on that too, which we may not have time for. Possibly it's on the website, I'm not sure. We can take a look at that. But I want to thank everybody for getting in the spotlight of children on the autism spectrum and helping to widen their spotlight as well to those of you who support teachers and parents in this endeavor. I know that this support makes a huge difference to maximizing these children's outcomes in terms of developing happy, socially confident individuals. And I want to thank particularly the children and the teachers from the University of Washington, from the EEU Center, who made these videos possible. I'm very grateful for them for that opportunity. Thanks very much.